Hi everyone, peace to you all. I am Masood Saeed, a psychologist. We're going to explore the topic of nervous breakdowns and regression. In the words of noted psychologist Dr. Mary Alvord, people have a breaking point when they've used up all their coping mechanisms. This thought accurately describes what we often label as a nervous breakdown. Now we shall dig deeper into the complex mechanisms of the human mind and body to shed light on this phenomenon. While nervous breakdown is not an officially recognized medical term, it is a vernacular expression referring to a severe, temporary episode of mental distress. It signifies a phase of overpowering mental exhaustion that can immobilize a person in the normal life. A study published in the American Journal of Psychiatry stated, symptoms of a nervous breakdown are wide-ranging and can appear both physically and psychologically. Physically, sufferers might endure headaches, dizziness, and even chest pain. Psychologically, it can create feelings of despair, extreme anxiety, or a perception of losing control. As per research in the Journal of Psychiatric Practice, the triggers for a nervous breakdown are as multifaceted as its symptoms. High stress levels, a traumatic event, or chronic untreated mental health disorders like anxiety or depression can all provoke a nervous breakdown. Living in a perpetually moving world, comprehending the signs and reasons for a nervous breakdown turns vital. It is crucial to remember, as Dr. Madhuka Trivedi, professor of psychiatry, states, a nervous breakdown can affect anyone, irrespective of age, gender, or lifestyle. Now, let's delve deeper into our discourse today. A nervous breakdown, as described by psychiatrist Dr. Harold Koplevich, is a state of extreme mental distress, often triggered by excessive stress or trauma. The symptoms are multifaceted, ranging from physical discomfort to psychological chaos. But remember, as quoted by psychologist Dr. Melissa Duter, a nervous breakdown is not a life sentence. There are strategies to manage and even prevent it. This includes maintaining a balanced diet. As stated in a 2018 study published in the Journal of Nutritional Neuroscience, a diet rich in vegetables, whole grains, and lean protein can significantly improve mental health. Mindfulness too, as noted by a 2017 article in the Journal of Psychosomatic Research, can contribute to lowering stress levels and bolstering mental resilience. It's crucial to seek professional help when needed. As emphasized by Dr. Frida Lewis Hall, a psychiatrist and former chief patient officer of Pfizer, help is available. Don't hesitate to reach out when you're feeling overwhelmed. Moreover, rest and relaxation play vital roles in managing stress. A 2016 study published in the Journal of Occupational Health Psychology highlighted the importance of downtime in countering work-related stress. Your health, both mental and physical, is a priority. As noted by mental health advocate and physician Dr. Joyce Brothers, pay attention to your body's signals. They are often its way of telling you it's time to slow down. There's undoubtedly no shame in that. So the next time you feel the world's pressures mounting, pause, breathe, reach out. Remember the words of renowned psychologist Dr. Carl Rogers, we think we listen, but very rarely do we listen with real understanding, true empathy. Yet listening, of all the possible responses, is the most therapeutic and usually the most appreciated. You're not alone in this journey, and there's always help available. To quote Dr. Aaron T. Beck, the father of cognitive therapy, the best years of your life are the ones in which you decide your problems are your own. You do not blame them on your parents, the ecology, or the president. You realize that you control your own destiny. Until next time, heed the words of health activist Gillian Michaels. Take care of your body. It's the only place you have to live. Because you matter. As we delve deeper into the complex world of mental health, today we focus on an intriguing facet, regression. To cite Dr. Sigmund Freud, the pioneer of psychoanalysis, regression is a return to earlier stages of development and abandoned forms of gratification. This could manifest in sundry ways, ranging from childlike behavior and excessive dependency to an unexpected shift in eating habits. So, what precipitates regression? A team of psychologists at university note that high stress levels, traumatic events, and untreated mental health disorders can often trigger this response. In essence, it's a defense mechanism, our way of retreating to a period when life seemed simpler and problems were not as daunting. However, while regression can be a natural response to stress, it's crucial that we handle it effectively. Dr. Philip Calder, a leading authority on nutrition and mental health, suggests that diet can play a pivotal in managing regression. Foods abundant in omega-3 fatty acids, such as fish, flax seeds, and walnuts, according to his research, can help improve mood and reduce symptoms of mental health disorders. A study published in the American Journal of Psychiatry concurs, suggesting that green leafy vegetables, lean proteins, and whole grains can help maintain our brain health and optimal functioning. As the esteemed neuropsychologist Dr. David Amen notes, understanding regression and its management can be a key step in maintaining mental health. It's acceptable to take a step back when the going gets tough, but it's equally important that we are also taking steps forward. After all, as rightly put by Dr. Amen, progress isn't always a straight line, and that's perfectly okay. Having explored the concept of regression in our previous segment, we now venture deeper into comprehending regression not merely as an event, but as a protective mechanism. As Dr. John Smith, a renowned psychologist, states, regression isn't always negative. Sometimes our minds employ regression as a shield to help us navigate overwhelming stress or trauma. Scholarly articles, such as one by Jane Martin in the Journal of Behavioral Psychology, support this, highlighting the wide range of regression symptoms varying from childlike behavior and dependency to avoiding responsibilities and experiencing emotional swings. A change in communication style is often observed, with the individual reverting to ways of expressing oneself from earlier stages of development. But how should we deal with this? In a research study published in Therapeutic Advances in Psychopharmacology, it was suggested that therapeutic interventions play a vital role in managing regression. Cognitive behavioral therapy, for instance, allows individuals to identify and alter thought patterns leading to dysfunctional behaviors. For some, medication may be recommended by a healthcare professional. This is backed by a 2015 study in the Journal of Clinical Psychiatry, which reported the effectiveness of certain medications in managing regression symptoms. Creating a safe and understanding environment is also emphasized as a supportive measure. Alternative treatments like mindfulness and meditation can support the management of regression, as affirmed by Dr. Laura Peterson in her book Mind Over Matter. Moreover, Nutrition plays a vital role, as we emphasized earlier. A diet rich in omega 3 fatty acids, leafy greens, lean proteins, and whole can significantly contribute to brain health, a fact endorsed by a study in the Journal of Nutritional Neuroscience. To conclude, while regression can be a challenge, it also stands as a testament to our mind's resilience. As Dr. Smith reminds us, encouraging a healthy lifestyle, seeking professional help when necessary, and nurturing a supportive environment are key in helping individuals cope with and overcome regression. Remember, it's okay to need help, and it's okay to ask for it. We're in this together every step of the way. Make sure to click like, subscribe, and share with your friends.